Hey guys, meet my doctor, Dr. Peter. This is the doctor behind my perfect hairline. Mnakumbuka nilikuwa na upara, nywele zilikuwa zimekulika zote, and it's been 5 months naangalia niko na full head of hair. Thank you so much, Doctor. So, I've been thinking, like, what is the approach that you use? The technique that you use on my hair ndio tukapata hii perfect results.
Yeah, for sure. You know what, Risper? The technique in Afro hair is so much different with other kinds of hair. Africa hair is magical. So let's say in Afro Doc, these are the approaches that we put forward. Like, we have 3 aspects of looking at when somebody approaches our clinic. What do we see? We look at the humanity. We look at also the science part of it. We look at the art science, the art part of it. Then we also look at the technological aspect part of everything. So when we talk about the humanity, like you look at somebody who has lost their hair, they are like in a space somewhere where they want revival. They want that confidence back. You want to feel like you look yourself in the mirror and you look like this is Risper again, not having like issues of like what am I going to wear today? Your hair, you combing your hair, you don't low self-esteem. So these are the things that we really try to focus on when somebody come in. And look at the science part of it. The science come in, did we make the right diagnosis?
Oh yeah.
You understand? There's some conditions which has caused scarring alopecia, which we are not supposed to do hair transplant. So African hair, there's some conditions which are only in African people. And you see, you cannot transplant in those kind of conditions. So the science and the diagnosis part of it should be able to come out properly before proceeding for transplant. Then you look at the art part of it. Now the art is African hair is different. Our hair curls. You understand?
Yeah.
Other kinds of hair are straight.
Yeah.
So our hair curls. So it curls. So even harvesting and planting it has to be done in a manner that African way. So if you do it in a Caucasian way, then you are botched. So these are the things we have to look at. The donor area. Do you have enough hair to put on your hairline? What made you lose that? These are the things that we really have to look upon. So in your case, it was purely traction alopecia, so removing hair here and putting it here. That is, but this depends with each and every patient and each and every condition. And then again, the technological aspect part of it. Which tools were used? We use FUE machine. So FUE is very, you remove hair, you put it, we don't cut anymore. So at AfroDoc, we do FUE, but we also, in the near future, we're going to do long FUE. Like in 6 months time, we're going to look to do long FUE. Long FUE means we don't cut the hair anymore.
Oh.
No cutting of hair.
Ningengoja 6 months.
No, but don't worry, you already got results.
Yeah.
So in the next period of months, we're not going to cut the hair. It's called long FUE. It's a new technique, and it's going to be offered at AfroDoc hair transplant.
Then, over time, I've been getting so many DMs. So many women asking me, for instance, I'm a chomeka. Sure. Can you do transplant kwa mtu mwenye amechomeka?
Yes.
You
sure.
can.
Everything starts with a consultation. So you come in, we have a look at your scalp. There's a machine called dermoscope. So it will be able to show us the blood supply. If the level of the scarring. You understand? So if there is sufficient blood supply, then we can go ahead and do a transplant. So everything starts with the consultation. We consult, we see what caused this hair and what is the approach that we can take to install this hair.
Okay. Thank you so much.
Everything is possible.
Well,
for sure.
For me, I'm one happy client. My results were 1 million,
We
1 million% right.
And thank you so much for trusting us.
Thank you. Thank you.
You must.
So, am I allowed to continue braiding?
This braiding, it has to be protective braiding.
Okay.
Protective braiding. Just loosely, not so much tight. No, just loosely braiding.
Okay.
And we are good.
Yeah.
Do protective
braiding. Okay, sawa. I wish in the near future utatengeza kinyozi for hair transplant, alafu pia salon watu tumetoka hair transplant, so that tusiende tuharibiwe tena.
We train our barbers and then the salonists so that we can be able to approach, because this African hair, it is magical as the term says. It's magical. So it has to be protected, it has to be taken care of very well. Even in terms of product that we use, it has to be very specific and centered towards African hair.
Thank you so much, Doctor. I appreciate one happy client.
Thank you so much.
Thank you.